How's everybody doing today? Today I'm going to talk about the use of CPAP in emergency medical services. I have a statement here that was said by Dr. William Blood of WebMD. This is something that kind of makes you think. It says, usually you don't even notice it, but 12 to 20 times per minute, day after day, you breathe. Thanks to your body's respiratory system, your lungs expand and contract, supplying life-sustaining oxygen to your body and removing from it a waste product called carbon dioxide. So what we're going to talk about today is we're going to talk about how the human respiratory system works, so a brief overview of that. And then we're going to discuss the diseases that affect the human respiratory system and how it functions. And then we're going to talk about how the actual CPAP, which is the topic of this conversation, how it helps that. And then how the patients who receive the CPAP therapy actually have an outcome through the hospital. Okay, so everybody knows what this is, the human body. Your mouth, your nose, what we do is we start by breathing in air or oxygen, same thing. It travels to the back of your throat, it comes down your trachea, into your bronchioles, and then into your lungs. And then it comes into these tiny sacs called alveoli sacs in the bottom of your lungs. In these alveoli sacs, this is where everything happens. Every time we take a breath, everything we do happens there. It supplies our body with the oxygen we need, and then that is actually where the carbon dioxide comes back out from the body that it's already used. So when the new oxygen gets down into the capillaries and the alveoli sacs, the old carbon dioxide from the body comes out and the new oxygen comes in, and that's what supplies your body. I got lost, sorry. It's very important for the respiratory system to work correctly for us to sustain life. When the respiratory system isn't working, it affects our entire body. All the organs we have rely on blood and oxygen supply. Without that oxygen supply, your organs will eventually die, which ultimately causes death to a patient. There are several disease processes that can affect how your respiratory system works. According to WebMD, there are several disease processes that can affect how the normal respiratory system works. Can cause organ damage or even death. Some of those diseases are congestive heart failure. I'm sure everybody's heard of this. CHF is the shortened version of it. Asthma. I'm sure everybody knows a lot of people with asthma. Chronic obstructive pulmonary disorder. It's like chronic bronchitis. People who get sick a lot of times during the wintertime. It's because of the COPD. Emphysema, usually caused by smokers. And then drowning, not really a disease process, but it affects your lungs the same way. As an EMS provider, our primary goal is to support a patient's primary functions of their body. So if their respiratory system isn't working, we do everything we can to allow them to breathe normally. In the past 10 years, there's been so many advances in EMS supplies. We've now been given what's called a CPAP machine. This stands for continuous positive pressure airway. And what it is a mask. It's just a mask that has an oxygen tubing that goes to an oxygen tank. We put this on the patient, and it provides them with that positive pressure to help them breathe. So a CPAP device is applied to the face of a patient who is suffering from an exacerbation of a previous disease process that we have discussed earlier, the COPD, the asthma, the emphysema. The CPAP machine, when applied appropriately, can actually save a patient's life within 3 to 5 minutes. What it does, like I said, it goes on the patient's face and makes a seal around their nose and mouth. The increased pressure will actually move any fluid that is accumulated in the alveoli sacs. It'll push that back out into the body. And then when you breathe out, it's actually, if you take your hand and put it against your mouth and blow against it, there's a back pressure. And it'll actually re-expand those alveoli sacs to make them bigger for that gas exchange. Before we had CPAP, we had options to treat these patients, but they weren't as good. We would have to do something that was called orotracheal intubation. So you actually pass a tube down their throat and into their lungs and mechanically breathe for them. So when these patients got sick, we pretty much wrote them off that they couldn't survive on their own without our help. So anytime a patient would be intubated, that would ultimately mean that they need to be on a ventilator, and then they had to spend time in the ICU following the intubation. According to Dr. Kenneth Narrow from EMS1.com journals, patients who underwent endotracheal intubation were at an increased risk of ventilator-assisted pneumonia, which increased mortality rates by approximately 60%. So these patients that went on the ventilator, they didn't usually have a very good outcome. So this CPAP that we have now is actually saving lives in an ambulance and at the hospital. So with the use of CPAP, we're actually reducing the negative effects and reducing the patient's care and the stay in the hospital. Within the past 10 years, medical advances have allowed EMS to treat these acutely sick patients in the field with less invasive procedures, greatly improving the field treatment to save a patient's life, reduce the time they spend in the hospital, and greatly reduce the chance of death as a result of these diseases. And this is just kind of my own thoughts. It's crazy to think of the advances in technology we've had in just the past 10 years since I've been doing this. So I'm pretty excited to see what it's going to be in the next 20 throughout the rest of my career. Thank you, guys.